Senator from Anderson, what purpose do you rise? Senator Cash.
See if the senator would yield for some questions.
Senator yields.
Senator yields.
Senator, it's a comprehensive bill. It is hard to digest. I think you would acknowledge all at one time. No doubt that's why it's taken us several days just to allow you to get through an initial explanation of the bill, and that's before those rise to speak who are against the bill. But I do want to try to clarify some things. Sure. Try to understand your thinking. I will ask a few questions, and that might help me as to whether or not I draft an amendment on some of these questions. I want to go back to the beginning, the definitions part, where you're saying that defining the cannabis products and how much THC they can have and so on and so forth. And let me try to articulate my concern here. In the certificate that a doctor is required to fill out, it actually says that a physician may also choose to include a specific amount of cannabis products certified every 14 days. I mean, that's section 4453 2080.
Subparagraph B.
Subparagraph B. It doesn't say that he must. I mean, it says that he may do that, but he may not as well. He just may certify that someone can have access to the cannabis products without saying how much they can get. And my concern is, when you go back to these definitions, it gives an amount for every 14 days that people can get for topical administration, oral administration, oils, etc. The different categories depending on how it's going to be applied. And so the way that I would put those two sections together, if the physician does not say how much the dosage is, so to speak, if he can say how much, he may say, but he may not, then that would allow, is the way I understand this, a patient could get all of these things, a supply of 14 for all of the cannabis products. Now, tell me what your thinking is about this. I know you're going to emphasize the physician, but your thing here says the physician may, but does not have to indicate what the patient should be getting.
All right, let me do the best I can to explain that, Senator from Anderson, is that I would think that the default setting, or what is going to be in most cases, is that a physician is going to go through that diagnosis and that what we've been through, authorize and say, yes, the patient has one of these qualifying conditions, and based on this patient's medical history, I think the cannabis could be a benefit. And in most cases, that's going to be all the certification says, and that certification is then taken down to, in this bill, a dispensary, or if the amendment is adopted, to a pharmacist, and that at that level, there'll be a determination made by the patient as to what form of cannabis that the patient wants to consume, whether it's orally or a lotion or something that can be vaped or a tincture. And there would also be a determination by the patient at that level of the ratio of THC and CBD that would be used. And again, this is where we get in. So that's the usual. I think that I would anticipate that being the usual case, and it would then be incumbent upon the patient interacting with the dispenser and figuring out what mode of consumption was most efficacious, what ratio of CBD to THC was proper for that person's endocannabinoid system. And I think that's a good argument for the proposition that there ought to be a pharmacist there with the experience that a pharmacist has in interacting with a patient. But what this bill, to your point, Senator from Anderson, says is that a physician may want to do more than just that, may want to do more than just authorize, and that a physician may in fact want to specify a certain amount of cannabis products. And I guess my best answer would be that would vary with the physician. It would vary with the degree of confidence the physician had with what sort of cannabis and what ratios would be most effective. So that's why it's discretionary. It is not mandatory that a physician do that, because all a physician has to do is authorize, and then that specificity occurs at the dispensing level. But that having been stated as the general rule, it is then stated that a physician may be more specific than that.
Senator, I appreciate the explanation. I think you might understand how that's going to raise some concerns, because several times you indicated the patient needs to decide whether it's topical, oral, and the patient needs to decide, how much CBD and THC, percentages they want in the product. Now, I anticipate the amendment with Senator Kimbrell, because I spoke to him for 30 minutes this morning.
Yep.
So I anticipate that we're pushing this over from a dispensary agent who, by the language of this bill, had no training at all, that I can tell, to a pharmacist. Now, I don't know what that amendment's going to say about a pharmacist training. I know that, as far as I can tell, a physician only has to have 3 hours of training to be qualified to write a certificate. And I think there's going to be some concern as to how much training a pharmacist should have to have, who is going to be, I think perhaps you would agree, the primary person who's then going to engage with the patient to say, well, how are you going to take this, and how much of this are you going to take? Would you not agree that we're going to have some discussion about
I think that's,
education for the dispensing agent?
Yeah, I think that's fair in both respects, in both in regard to the physician and in the amount of education the physician has in regard to making that certification. And I think you make a valid point in regard to if it's a pharmacist, and for the sake of argument, I'm going to assume it's going to be that, whether or not the amount of education we're requiring is sufficient in order for that pharmacist to discharge what the expectation is. Because I'll frankly admit, you're right, that unlike with a lot of other prescriptions that doctors issue, where there's a great degree of specificity on the front end by that physician in regard to, not only the type of medication, but how often a day the patient takes that medication, that's not going to, by and large, be what we're talking about here. What we're talking about here at the physician level is an authorization that, yes, given your condition and given your medical history, it is that physician's medical opinion that medical cannabis can be efficacious. But to your point, the exact mode of that, of taking that cannabis, whether it's an oil or a vaped or tincture or whatever, and the ratios of the two primary chemical components of cannabis, THC and CBD, a lot of that is going to take place of necessity at the dispensing level, at the pharmacy level, because cannabis acts so differently with everybody's endocannabinoidal system, and everybody's endocannabinoidal system is different. And so what may work for you, if you had irritable bowel syndrome, and what worked for you was, a ratio of 15 to 30 of THC to CBD, that may not be what works for me if I go down there with the same condition. And there's going to be a degree of trial and error there, and that really speaks to the wisdom, I think, of having a qualified medical professional at that dispensing level, at the pharmacy level. And we can have a talk about what sort of education is going to be sufficient in order for them to fulfill what we think they should do.
Sure. And I appreciate your comments, and I will be interested, to see what the senator from Newberry thinks about that, because, right now we're talking about 3 hours of education for the physician. Senator, I'm just going to bring this up, and I recall on the bill last year to allow pharmacists to prescribe birth control pills. They had to have 3 hours of education before they could do that, and then 3 hours of continuing education each year in order to do that. I'm not sure there's even continuing education in this bill right now, but
there is for the physician, and I think it's in there for the pharmacist in the amendment, but I would need to look at the amendment. But it's in there in regard to the physician would have to have that annual certification of education, continuing medical education.
Okay, well, I do think, maybe in conjunction with the senator from Newberry, we're going to have some greater degree of comfort because, as you would tell us, I mean, it's not just CBD and THC. From what I've read, there's over 100 different compounds present in the marijuana, and as you've just said yourself, they might work different ways for different people. And I think I understand the basic premise here, which is maybe it's been explained as start low and go slow, in your usage of these different products to see what might be effective for someone. And I've got a feeling that if this pharmacy amendment goes through, that's going to be put upon the pharmacist really to engage more so than the physician as to what mode they're going to use and how much they're going to use. And I think we're going to have some discussion and something written in here about what a kind of education the pharmacy agent's going to have.
One thing I'd point out too, Senator Anderson, and you're right, and we're fortunate to have in the body a professional pharmacist that can really inform us on that. But one of the things I would point out is the requirement that after a physician authorizes a patient to use cannabis, and after that patient then goes to a dispensary or to a pharmacist and gets that cannabis, there's a requirement that that patient can then go back to the physician for a follow-up appointment. So I would anticipate there's going to be the opportunity for conversations between the pharmacist and the physician, as well as with the patient, in terms of that going back to the physician within 6 months after the initial authorization. So what I would imagine is you're right. I think a lot of it occurs at that dispensing level in terms of testing and seeing what's efficacious. But there is that information loop back to the physician put in here for that reason. And that I wanted there to be an information feedback from that dispensing level back to the physician.
Senator, we touched upon this a little bit the other day, but I just want to make sure that everyone understands that PTSD is included for first responders, but then another portion of this bill prevents someone from being a card holder if they are involved in public safety, commercial transportation, or operating heavy commercial machinery. And so when I put all that together, as I understand this, people who work in public safety, commercial transportation, they can't get a card unless perhaps they're retired and no longer active. Is that the way you understand all this being put together?
My understanding would be that if you're currently employed by one of those employers, that you could not have a card, whether it's law enforcement or I think another instance was commercial trucking. And again, as I tried to say last week to Senator Sen, Senator from Charleston, there's a balancing act here between trying to get medicine in the hands of people who need it and really, quite frankly, deserve it, and the concerns that have been expressed by certain types of employers in regard to what the use of cannabis by one of their employees might be in the performance of their duties. And I've tried to strike that balance. I don't claim that this bill is internally consistent in all its respects. But in each case, what I've tried to do is listen to concerns expressed by stakeholders and try to accommodate those concerns, because I recognize that a piece of legislation like this, if I want it to pass, and I do want it to pass because I want to start getting relief to people, it's going to have to take into account the concerns that are expressed by powerful constituencies if it's going to have a chance.
Sure. Going further in the definitions, I want to get clear in my mind what's meant by the word physician. I didn't have time to go study the code that refers, when I think of physician, I think of someone who, for lack of a better expression, is board certified medical doctor. Now, is that what is meant by section 40-51-20, which is what it's referenced to? This is definition number 25, right, physician.
Yes, I have that is, and what I would further say is
Or a podiatrist. Can you clarify why a podiatrist is mixed in there with physicians?
The physicians, I guess the short answer to your question is the podiatrist indicated an interest as a profession in being an authorizer. I mean, that's the answer there. In regard to physician, I believe that your interpretation is that it is somebody who's been authorized to practice medicine by the Board of Medical Examiners. And then also, it has to have, in regard to authorizing a patient to use cannabis for a condition, the condition for which it is authorized must be within that physician's area of practice or specialty or expertise. So there is that restriction placed on it as well. Again, fair point. I mean, we're talking about who the gatekeeper is going to be, and you know, do we tightly enough define that gatekeeper? Do we confine the number of individuals who qualify to be that gatekeeper appropriately? And I think you raise a good point. I mean, we can have a discussion on here as to whether or not it's appropriate to include podiatrists within that particular universe of authorizers. I think that's a fair point.
I want to move over to the advisory board for a minute.
What section is that, Senator?
It's 4453-2060, the Medical Cannabis Advisory Board.
Yep.
I'm not trying to be too picky, but I do want to know or ask, should we not stipulate how the chairman is appointed? Because it's not in this language as to, I mean, you've got 11 members here. I think it needs to say, you know, if the governor appoints the chairman of this board, I think there needs to be a chairman of the advisory board. That might need to be in here somewhere. And then the only other question I would have that I think maybe needs a little thought is whether this board really needs to meet twice a year, because this foresees that the board might need to be doing studying to add additional conditions and having even public hearings as to whether or not certain conditions should be added. And, you know, these people are volunteers, you know, other than getting some mileage and stuff. Do we really need them to meet a minimum twice a year? Could this be done once a year? And as part of this ongoing study and review of the study that's ongoing and being published all the time, you know, the language allows for additional conditions. Would the language ever allow for conditions to be removed if the studies show that, all right, we've had enough study to know this is just not a condition that's helped? It shouldn't be on a list.
Yeah. I think to your point, I think, and I had that conversation with another senator, senator from Spartanburg, who also brought that point to my attention quite reasonably, that if we're going to charge this commission with following where the science is and making recommendations as to additional conditions that could be treated by cannabis, the converse ought to be true as well, that if medical science further develops and it turns out that, you know, it's not going to be efficacious, then I agree that we ought to add that as well. I think that's a fair point.
Senator, I've got additional questions, but I think the majority leader here might want to be concluding here very shortly.
Oh, what time is it? Time flies.
Senator from Spartanburg, Senator Martin.